This presentation is about providing standardized care when accessing or deaccessing implanted ports in order to prevent central line associated bloodstream infection, or CLABSI. First, we'll review a few general considerations for implanted ports. Always follow aseptic technique when providing implanted port care. This does include using sterile gloves. Always use a non-coring needle when accessing an implanted port to prevent damage to the septum of the port. It is also important to use the appropriate length of needle that allows the needle apparatus to sit flush on the skin. This helps prevent needle dislodgement. Only use 10 cc normal saline flushes when flushing an implanted port. When using multiple chamber ports, each chamber is treated as a separate line and is flushed and heparinized accordingly. When a port is not in use, the needle may be removed, but the port should be accessed at least once a month or according to provider orders and flushed with 20 mL of normal saline, followed by 5 mL of 100 unit per ml heparin solution to maintain patency. Only implanted vascular access ports and non-coring needles designed for power injection shall be used with power inject equipment for radiologic imaging in accordance with the manufacturer's directions for use. Gathering the needed equipment. Before the procedure, you should gather all of the equipment you might need when accessing the port. This includes sterile gloves, a face mask, ChloraPrep applicator to clean the skin, a sterile transparent dressing to place over the site once the port is accessed, 2x2 gauze pads, alcohol wipes, and paper tape. If the patient prefers, it also includes topical analgesic gel or spray. Obtain a 90-degree non-coring Huber needle with extension tubing and a clave to attach to the extension. If the patient has hair in the area you will be accessing the port, surgical clippers should be obtained as well. Finally, you will need two 10 ml pre-filled normal saline flushes and a 5 ml pre-filled heparin syringe if the port will be deaccessed after it is used. The next step will be to prepare the patient. Upon entering the room, the nurse will thoroughly wash their hands, assemble your equipment, and explain the procedure to the patient. Position the patient in the semi or high Fowler position. Fully expose the area around the implanted port. Assess the area for signs of infection or thrombosis and report any of the following to the provider before continuing. Edema of the neck, face, shoulder, arm, or prominent superficial veins, erythema, skin color or temperature changes, inflammation, purulent drainage, pain or tingling in the neck, shoulder, or arm, or tenderness upon palpation. Palpate the area around the port and locate the center. Clip chest hair if needed. Finally, instruct the patient to turn their head away from the site once the procedure begins, or ask the patient to put on a mask. The next step is preparing the equipment. First, the nurse should apply a face mask. Next, create the sterile field. Open equipment using aseptic technique and drop the equipment onto the sterile field. Next, apply sterile gloves. Apply the clave to the administration set and attach a 10 ml flush syringe. Flush the administration set and the Huber needle with normal saline. Once you have your sterile field and equipment prepped, the next step will be accessing the implanted port. The first step in accessing is to clean the port site with ChloraPrep. Beginning at the center of the port, move in an outward circular motion until you have painted a circle 3 to 5 inches in diameter. Allow the area to air dry. Do not blow on the area. You can now apply the topical analgesic using aseptic technique if the patient prefers. Using a quick, smooth motion, insert the Huber needle at a 90-degree angle into the center of the implanted port. Confirmation of placement will be next. Without pulling on the extension attached to the Huber needle, flush the port using a 10 ml pre-filled normal saline syringe and attempt to aspirate for blood. If you do not get blood return, gently push down on the Huber needle to assure it is in the port and attempt to aspirate again. If you still do not get blood return, refer to the troubleshooting guide. If blood return is obtained, flush with another 10 ml pre-filled normal saline syringe to ensure all blood is removed from the extension tubing. While pushing the last 1 ml of the flush, clamp the extension, then remove the syringe. Finally, apply the transparent dressing over the Huber needle to secure in place. Next, we will discuss deaccessing the port. Again, upon entering the room, the nurse will thoroughly wash hands, assemble your equipment, and explain the procedure to the patient. Position the patient in the semi or high Fowler position. Fully expose the area around the implanted port. Assess the area for signs of infection or thrombosis and report any signs observed to the provider before continuing. If there are no signs of infection or thrombosis, apply gloves and remove the transparent dressing, beginning at the outer edges and working toward the port until the dressing is gathered at the Huber needle insertion site. Using one hand, firmly support the port between two fingers and withdraw the Huber needle by pulling it straight out away from the chest. Apply a folded 2x2 gauze with paper tape over the puncture site and instruct the patient to leave the dressing in place for at least 2 hours. For more information about implanted port care or central venous access devices, please refer to Clinical Services Policies CLIN-423 and CLIN-423-AA. Thank you for your participation in the prevention of central line associated bloodstream infection.